Good day. This is the feedback on the practice bank that I gave you that involves the feet and the toes. Please keep your opinion form at hand so that you can self-mark this formative activity. So the first case that I gave you is that of a patient who was referred with pain over the second and third metatarsal. So if we look at the software, we are able to see on the second metatarsal, and I'm just going to zoom in a little bit more, that there is some fluffiness around it, which indicates that there is a healing fracture taking place. And then on the oblique view, we are able to see the healing fracture on the second metatarsal, but on the third metatarsal, there's also some subtle signs of fluffiness around the distal third of that metatarsal. So it also looks like the third metatarsal has got signs of a healing fracture. So this, because if we look at the clinical indications, it indicates that this is a patient who was referred with foot pain and no evidence of any injury has been given. So in all probability, this will be a stress fracture. There is, however, an incidental finding. If we look at the angle of the big toe, we can see that there is a hallux valgus as well. So the second case is that of a patient who has also been referred for an X-ray of the right foot, and the patient has got pain over the cuboid and the first cuneiform, and that follows after an injury that the patient had to the foot. So I think here I'm just going to just change up. It's a little bit better, and then zoom in. Okay, so if we look at the cuboid, so this is the cuboid, that's the navicular bone, and there's our cuneiforms. We can see that there is a fracture on the lateral aspect of the cuboid. The cuneiforms actually look quite okay. However, when we look at the navicular bone, there is a fracture also at the lateral aspect of the navicular bone. So there are two fractures. The one fracture is that of the cuboid, and the other is that of the navicular bone. So the next case is that of a toddler who had an injury to the foot after a fall. So if we just zoom in here again, we're able to see that there is a buccal fracture at the base of the first metatarsal, and that is the only visible injury on this patient. So case 4 is that of a patient who was referred for a foot X-ray, and that was after a car accident. Unfortunately, there's only one single view available for this patient. So the first thing that would probably attract one's attention would be when we look at the metatarsophalangeal joint of the big toe, that there is a subluxation. However, if we look at the Lisfranc joint, so it's the joints at the base of the metatarsal and the tarsus bones, we can see that there is a displacement there. So there's a Lisfranc joint dislocation. And then if we zoom in further, we are able to see that the cuneiforms has been fractured. It also appears as if there's suspicions of fractures of the second metatarsal basis and maybe also of the third metatarsal basis. And there is an incidental finding. So this is not an avulsion fracture, but it's an incidental finding of an os peroneum. So the main finding for this patient then is a Lisfranc fracture, dislocation with fractures of the cuneiform, and then it also resulted in subluxation of the metatarsophalangeal joint of the big toe. So the final case that I've given you is that of a patient who has been referred for an X-ray of the foot and who has had a previous injury to the foot. So I'm just going to change the setting slightly and then zoom in. So if we look at the head of the second metatarsal, we can see that it's more sclerotic if we compare it to the other heads. And there's also this flattening of the metatarsal head. And that is in keeping with avascular necrosis, which could be the result of his previous injury. This is also known as Freiberg's infraction or Freiberg's disease. And then there are some arthritic changes to the metatarsophalangeal joint as well. So I hope that you have worked through the 5 cases. And if you have got any questions about the 5 cases, please feel free to contact me. Thank you.